here this morning. And I guess I want to tell sort of a personal story because, as the saying goes, all politics is personal, and everything that's personal starts with stories. So I'm going to tell you a little bit my own story to why I care about healthcare and about healthcare activism. So I'm going to call this From When and Where I Enter because it's about a little bit about where I find myself, being a Houstonian, being a Texan, being an American. I am representing Healthcare for All Texas, so we are the umbrella organization that represents Texans for single payer. I am a family physician, and I just want to start out with a quote. I'm going to read it to you since maybe not everyone can see. It says, fierce proud, I coolly defy 1,000 pointing figures, head bowed like a willing ox, I serve the children. It's a philosopher named Lawson, who was, I guess, around the time of the Chinese Civil War. And I quote this to say that, you know, I think we're all here not just to serve ourselves, but to serve the people, to serve our children, I don't have kids yet, to serve our grandchildren, to serve the future generations. That's his point. And I center myself around that because I feel like I am a child or almost like a grandchild of the Asian American movement of the 1970s, which is itself a child of the civil rights movement of the 50s and 60s. And I want to tell you a little about why that matters to me and who I am and what its relation to this, and also what its relation to you is, and the context. So I'm going to give a little bit of a history lesson to y'all, and another quote. So this is from one of the founders of a community health center in New York City named Harold Louis from the 1970s. So he says, you're never going to make a lot of money. You're not going to change the whole world. You're not going to make Republicans into Democrats or change capitalists into socialists, but you can often help some often alienated people to improve their lives. There's nothing wrong with that. So sadly, you know, the people in Washington or in Austin have forgotten what they're there for, is to help people who are often overlooked and alienated, or they're saying that they're trying to help the forgotten people, but they're actually just completely forgetting them at all, right? So, you know, so that starts my history lesson. I want to thank a friend from Rice for the history slides. I also want to thank my wife who is allowing me to be here this morning. And I do want to say a disclaimer. Opinions my opinions only do not represent any of my prior or current employers. So, but to start off, you know, so who am I? I used to work here. So my parents, you know, they thought I worked in this wonderful ivory tower, the best med school in the South, which is, you know, they thought I worked at Ben Taub, which is not true. Many people from the Asian American community thought I worked here. There's a community health center called Hope Clinic that's in Southwest Houston. I don't work there either. I used to work here, okay, this kind of government-looking bunker called Valbona Health Center, previously known as People's Community Health Center. Okay, it's at the corner at the Moss and Tardif, which is really close to Hillcroft and Bel Air. It's been there about 20, 30 years. And it started out as People's Community Health Center. The name was given to it by a Catholic nun who worked at one of the churches in the neighborhood. Said we should call it People's because it's for the people. Okay, and as and many of y'all know, you know, Sharpton Gulfton is kind of like the Ellis Island of Houston. And when I center myself, I think about this picture on the left, which is Bel Air Boulevard. So that's Bel Air Beltway, and it's looking toward town, so towards the medical center, towards downtown, and leading towards my clinic, which is on the upper right. That's the waiting room, and which also leads to the end of the trail is the other one at the bottom right is the Ben Taub second floor. How many of you have been to Ben Taub? Okay, how many of you been to the second floor, where you're waiting for the specialty clinics, where you wait hours upon hours to see a specialist? Because that's the state of healthcare still in our state, in our city. It is, not, it is still the same, essentially. That football field long waiting room still is packed all day with hundreds and hundreds of people, okay? And that is unjust. About a year ago, I switched from Baylor. So I worked at that community health center for about 4 years, largely uninsured. 80% of the people have no insurance. They get what's called the Harris County Gold Card. It's not insurance, it is a repayment plan. So it allows you to be seen, but only within the Harris County Hospital District. Okay. So mostly immigrants, people who are working class, people working 2 or 3 jobs just to make ends meet. And is that healthcare? No. Right? Now, about a year and a half ago, 2 years ago, I went to another institution. This is an A-leave, so they were trying to say that they want to take care of people, so they built very nice facilities. And at the end of 2 years, we parted ways because they told me, we built this clinic for the community, but we're not really here for the community. We really just want you to see, we were going to see uninsured patients, we're going to see indigent patients, but we don't really want that. We really want to see paying patients. So we parted ways. I currently work for another organization. This is not my clinic, but it is part of that organization. And it is about taking care of the least of these in our community. And it's been around for about 30 years. A lot of you probably recognize it. Sorry, it's a little blue emblem in there. So I feel like I'm working in a place where we, for the community, for taking back our healthcare, because 30, 40 years ago during the Civil Rights Movement, there was a movement across the country called community health centers. That would be community-based, people from the community, and that it would be providing opportunities to the community and taking back our healthcare. And that's what we're all here for, right? Is to take back our healthcare from exactly what he just said, from the corporations, from pharmaceutical companies, from the insurance companies, and make it about the people, about community, and not about profit. So how did I get here? I'm sort of an accidental activist, okay? My parents are from Taiwan, came here for economic opportunity. And I was born in 1979, and what happened to me should be a cautionary tale for everyone who thinks, oh, everyone gets healthcare in the country. Because when I was born, I came out 2 months early. And so our local hospital didn't have a NICU, so they life-flighted my mom to the medical center, and I spent the first 3 months of my life in the NICU, in the ICU. Think of how much that might cost these days, or back then, $1 million, $2 million. As an immigrant family, who can pay for that? Luckily, my dad had really good insurance through NASA, but does everyone have that? No. Fast forward to middle school. So, well, let me start off with this. What is this? Or where is this? Houston. It's Houston, okay? So I grew up in that bottom right corner, which is Clear Lake, okay? And what does this represent? The different colors. Right, I heard like by ethnicity or race. This is the breakdown, this is a map. So you have like in the center, downtown, and then, kind of Westview Medical Center is in the middle. I grew up down there. And I bring this up because I feel like I do this work, I work in underserved communities because of my experiences growing up. I grew up in Clear Lake, but so, I bring up freshmen because, happy-go-lucky childhood, I wasn't born in Philly, born and raised playing basketball with all, whatever. Sorry, I can't rap. But, my parents drove us to Chinatown, Bel Air every day. We grew up with astronauts, kids. But then when I got to middle school, because of school overcrowding, I got sent to Seabrook, and I kind of got beat up some. And it was really the working class whites, blacks, and Latinos that stood up for me. And so now I feel like I stand up for them. So in high school, what happened in 1994? This happened. Remember this? Everyone's gonna have health security. And we knew at that time that we're spending way beyond our means, 14% of GDP on healthcare. And part of another awakening was this. In 1999 at Rice, when I was in college, and I'm trying to bring you this history because I want to connect all of this, civil rights and different movements. There was a group that came on the campus that said, don't have sex with black men, they give you AIDS, okay? So I bring this in to say that we're always trying to other, there's this flyer that says, caution the third world invasion of Canada. I mean, this thing happens all the time. I bring this up because part of my awakening is about activism, the Asian American movement of the 70s, their 80s, there's this gentleman, Vincent Chin, in 1982, he was murdered because people said, oh, you're taking, you Japs, he's Chinese actually, you Japs are taking away our jobs. The out-of-work auto workers in Detroit, beat him to death, and they never served a day in jail. So people from our community mobilized against that. And it's a long history. It's about the Yellow Peril, it's about the Chinese Exclusion Acts, the Asiatic Exclusion Zone from the 1900s, which ironically looks a lot like this, right? And so I became active, and I looked to mentors like Yuri Kochiyama, who I don't know if y'all ever heard of her, but she was an activist in New York City. Malcolm X, actually, when he was murdered, died in her arms, and that's me with her when I was in college. And also that about labor, about the United Farm Workers, or other not known histories about Filipinos that are grape workers that fought along, they led the movements for labor with Cesar Chavez. That's right, him, but there's Larry Ilion on the left, Filipino organizer. Asian Americans fighting alongside the Black Panthers or protesting against the Vietnam War. Out of the 70s, people started to organize. This is a mentor of mine, Art Chen, who was one of the founders of the Chinatown Health Clinic in New York. And they were the ones that had health fairs like this that said, we need healthcare for the people. And that clinic is now, 40 plus years on. But even today, we're still struggling. We're struggling because of many issues, like, Baltimore, and Black Lives Matter. So why am I getting this lesson? Because healthcare should be a human right, right? Because also everything is connected, because if you care about women's rights, you care about Black Lives Matter, you care about farm workers, you care about immigrants, you care about LGBT rights, you care about the Muslim ban, then you should care about healthcare. And really, because of this, because of MLK, who said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Remember, the March on Washington wasn't about race. It was about jobs. It was about opportunity. It was about healthcare. But the right has turned it into this whole, we're all gonna kumbaya and be happy together. So over the past 10 years or so, I don't know if you remember this, Judy, we've been marching for healthcare for all, Medicare for all. One of my former mentors in San Antonio calls it a system of no system. So this is our healthcare system. It's a spaghetti, okay? No one understands it. We spend, this is the US over here, we spend 2.5 times more any industrialized country. We don't get our money's worth because this is our life expectancy way down that way. And still, children are uninsured. This is the rest of the country, it's leading us behind. Oh, there's Texas in the middle. And this is currently, we're still about 20% uninsured. And if you think it can't happen to you, It can, because you know, I've been denied insurance for pre-existing conditions. I've been uninsured, and this is my Obamacare card, and this is enough because I can lose this at any time. So Tony is telling me I'm out of time, but I just want to wrap up and say, you know, when we think about all these other movements, you know, are we being inclusive? Because, you know, Stephen Kleinberg from Rice says, we're the most diverse city in the country. He also says Fort Bend County is the most diverse place on the planet. But are we being inclusive? Because when we have these movements around healthcare, about all these issues, you know, are we being fair to our fellow Texans, to Texas women? This is the poverty rate by race ethnicity, you know. This is the insurance rate by race and ethnicity. This is the life expectancy of different groups, and you know, there's huge inequities there. This is the people's determination of their health status, how they're doing. And here's my friend Lucy, who's a nurse educator. We're trying to keep kids out of trouble for this summer, but this is the maternal mortality rate in Texas right now, compared to the rest of the country. And what is the state doing about it? What's the legislature doing about it? They're cutting Planned Parenthood and women's health care. And last point I want to make, this is the former Surgeon General, Vivek Murthy. So he took a stand on the opioid crisis, you know, that why are we all dying? You know, and do we actually have so much health care? Sorry, this sounds very much like the president. We have so much health care that we're actually killing ourselves with it, right? And that we are not getting anywhere. You know, our wages have not gone up, and all of that, our salary increases have really just gone to healthcare. So, in summary, this is another mentor of mine I look up to. Her name is Grace Lee Boggs. She worked in inner city Detroit. Okay, great. Many of you all know who she is. She's Chinese American, worked with African American communities in Detroit, and she said, to make a revolution, people must not only struggle against existing institutions, they must make a philosophical, spiritual leap and become more human beings. In order to transform, change the world, they must change and transform themselves. So I'm asking you, do we want this picture to continue, where we have the haves and the have-nots? To continue this, the waiting room of Ben Taub, where, oh, sorry, you don't have insurance, go to Ben Taub, because that's where you need to go. Or, do we want to be inclusive? Do we have a vision of our city, our state, that we are inclusive, that we are here for Medicare for all, everybody in, nobody out? Thank you so much.